This skull has a hole in it, not from a weapon, not from time. Someone made it, while the person was still alive, and the bone healed. That last detail changes everything. A hole can show injury. A healed edge shows survival. No hospital. No anesthesia. No antibiotics. No CT scan. No sterile operating room. Thousands of years ago, someone opened a human skull, and the patient lived long enough for the bone to begin repairing itself. In one study from the Cusco region of Peru, archaeologists recorded 66 trepanned individuals and 109 skull openings. The estimated survival rate was about 83%. So the real mystery is not whether ancient humans opened skulls. They did. The deeper mystery is how so many survived, and why anyone would risk cutting into the head in the first place. Today, skull surgery feels like one of the most serious things medicine can do. We imagine neurosurgeons, CT scans, sterile rooms, anesthesia, metal instruments, monitors, and emergency teams. The skull protects the brain. Cutting into it without modern medicine sounds almost impossible. Ancient bone tells a different story. Researchers have found skulls with openings that were scraped, cut, drilled, or carved with clear intention. Some patients likely died. Others did not. The proof is not a written note from an ancient doctor. It is the healing around the opening. That healing forces a difficult question. Were ancient people simply desperate? Or had some of them learned a real surgical skill? So what were ancient humans actually doing? Were they treating head injuries? Removing broken bone? Trying to reduce pressure after trauma? Responding to seizures, pain, or strange behavior? Or performing a ritual based on beliefs we no longer understand? The honest answer depends on the skull, the place, and the period. But the practice has a name: trepanation. It means making an opening in the skull, and it may be one of the oldest known surgical procedures in human history. Picture a small ancient community. A person has been struck in the head. Maybe during a fight, maybe in a fall, maybe while hunting, maybe by a stone, club, or weapon. They survive the first injury, but something is wrong. The pain does not stop. The skull may be cracked. The person may collapse. They may shake. Speech might change. The body may seem close to death, but not gone yet. There is no hospital, no X-ray, no medical chart, no germ theory, no modern explanation for bleeding, swelling, pressure, or brain trauma. The group still has something powerful: observation. Someone has seen head wounds before. Someone remembers which injuries killed quickly. Another person remembers who recovered. Broken bone may have seemed different from ordinary pain. Pressure beneath damaged skull may have appeared connected to decline. Ancient medicine did not begin with perfect science. It began when repeated danger forced people to notice patterns. Sometimes, those patterns led to terrifying experiments. The strongest evidence is the edge of the opening. That is where archaeologists look first. A sharp, fresh-looking edge can suggest the person died during the procedure or soon after. A rounded edge tells a different story. New bone growth means the body had time to respond. The wound had begun to heal. That means survival. Not always for years. Sometimes perhaps weeks. Sometimes months. In some cases, much longer. But long enough for the skull to repair itself. This is why trepanation is so shocking. A hole alone does not prove success. Healing does. In the Cusco study, Valerie Andrushko and John Verano found that circular cutting and scraping were the most common methods. Those methods mattered because they gave control. Scraping could slowly thin the bone instead of breaking through it violently. Circular cutting could create a more controlled opening. The evidence suggests these were not random holes. They were repeated techniques. And in that region, many patients lived. That is why the numbers from the beginning matter. 66 individuals. 109 openings. About 83% survival. Those figures turn an ancient skull from a curiosity into a serious medical puzzle. The tools were simple: stone, bone, shell, obsidian, later, metal. Simple tools, however, do not mean simple work. A practitioner had to avoid going too deep. Beneath the skull were the brain and the protective tissues around it. One careless movement could kill. Bleeding could become fatal. Infection could follow. Shock could end the patient's life, even if the opening was made correctly. The procedure demanded control. Scrape too little, and nothing changes. Cut too deep, and the patient may die. This was not only about the hand holding the tool. The group also mattered. Someone had to steady the patient. Someone had to prepare the instrument. Someone had to manage blood. Someone had to clean and protect the wound afterward. The dangerous moment was not only the cutting. Survival depended on care after the opening was made. That is where trepanation becomes more than a skull with a hole. It becomes evidence of skill, risk, and social support. The Peru evidence becomes more surprising when researchers compare periods across time. David Kushner, John Verano, and Ann Tittlebaum studied trepanation outcomes in prehistoric Peru and compared them with other examples of cranial surgery, including the American Civil War. Peru matters because more than 800 trepanned skulls have been reported there. That is more than the rest of the world combined. The researchers used one clear clue: healing. If the skull showed bone repair, the patient likely survived. If there was no healing, death probably came during the operation or shortly after. The pattern was striking. In the earliest Peruvian period they studied, survival was about 40%. Later, it rose to about 53%. During the Inca period, from roughly the 1400s to the early 1500s, survival reached about 75 to 83%. Some smaller regional samples were even higher. Now compare that with cranial surgery during the American Civil War. More than 3 centuries later, with metal instruments and trained military surgeons, mortality from cranial surgery was still around 46 to 56%. That comparison needs care. Civil War doctors were dealing with bullets, shattered bone, battlefield infection, and chaotic hospitals. The injuries were not the same. The conditions were not the same. But the contrast still matters. It suggests that ancient Peruvian practitioners were not simply guessing forever. Over generations, they appear to have learned. Smaller openings were safer. Some areas of the skull were more dangerous. Scraping reduced the chance of sudden deep damage. Technique changed. Survival improved. The numbers do not show modern brain surgery. They show ancient knowledge being tested by life and death. The biggest question is not only how, it is why. One reason may have been head trauma. Ancient life was physically dangerous. Falls happened. Weapons struck skulls. Hunting accidents caused injuries. Violence left fractures. A person with a serious head wound might already be dying. In that situation, doing nothing may have seemed just as dangerous as trying. Trepanation may have been used to remove broken bone, clean damaged tissue, reduce pressure, or respond to symptoms after injury. Another reason may have been pain or behavior the group could not explain. Severe headaches, seizures, dizziness, collapse, confusion, strange movements. Modern people may see these as medical symptoms. Ancient communities may have understood them through both body and belief. For some, opening the skull may have been treatment. For others, it may have been ritual, a way to release pressure, a way to let something harmful escape, a way to fight an invisible force. The procedure could be practical and symbolic at the same time. That is what makes it so fascinating. It sits between surgery, fear, belief, and the desperate hope that a living person could still be saved. There are 2 easy mistakes. One is imagining ancient people as secret modern neurosurgeons. They were not. They had no sterile operating rooms, no modern anesthesia, no antibiotics, no brain imaging, no scientific understanding of bacteria. Many patients probably died. Some procedures may have been desperate. Others may have been ritual. Some may have been based on beliefs modern science would reject. The other mistake is thinking they were foolish. The skulls do not support that either. They observed, they remembered, they tested methods across generations. They repeated techniques that seemed to work. They changed where they cut. They changed how they opened the bone. In some places, survival rose over time. That means knowledge was accumulating. Not perfect science. Not blind superstition. Something in between. Human beings trying to solve a terrifying problem with the tools, memory, and beliefs they had. Trepanation changes the way we see ancient survival. Survival was not only hunting animals, not only finding food, not only avoiding predators, it was also learning what to do when the body failed. A broken bone taught something. A poisoned meal taught something. A difficult birth taught something. A skull injury taught something. Over time, memory became practice. Practice became skill. Skill became tradition. This is the part of ancient humanity that is easy to miss. People were not only reacting to danger, they were intervening. They were taking risks to treat pain. They were experimenting with the body long before modern anatomy. They were trying to save the living before hospitals existed. That does not make the past safe. It makes it more human. Because even without modern medicine, people still looked at suffering and asked one of the oldest human questions. Can we do something? Return to the skull. The hole is still there, but the opening is not the most important detail. The healing is. That smooth edge means the person did not die immediately. Someone opened their skull. Someone may have held them still. Someone may have cleaned the wound. Someone may have brought water. Someone may have watched through the night to see if breathing continued. And somehow, against what many modern people would expect, the body began to repair itself. That is the power of this evidence. It shows fear, risk, skill, belief, care. Ancient humans did not perform brain surgery like doctors today, but they did something almost as shocking. They opened the skull and sometimes kept the patient alive. Long before hospitals, humans were already trying to cross the line between injury and survival. Prehistory did not disappear. It still lives in every human instinct to face the impossible and try to save someone anyway.